Clinton Wright, and I am the director of the Division of Clinical Research at the National Institute of Neurological Disorders and Stroke at the National Institutes of Health. So there's two types of stroke. The most common type, which makes up about 75 to 80% of strokes, is when a blood vessel in the brain gets blocked, and that damages the tissue because it's not getting blood anymore, not getting oxygen and the nutrients that it needs. About 20%, 25% of strokes are caused by bleeding into the brain, where one of the blood vessels in the brain ruptures and the blood, goes into the brain tissue and damages the brain tissue. So recognizing the signs and symptoms of stroke is critically important, because there's only a certain amount of time that you have to actually do that. And so those symptoms are things like numbness or weakness of the face, arm, or leg, especially when it happens on one side of the body. Confusion that happens suddenly, trouble speaking or understanding speech, sudden loss of vision in one or both eyes, or trouble seeing, double vision, things like that, sudden trouble walking, or dizziness or loss of balance or coordination, or a sudden severe headache with no underlying cause, that someone is used to having headaches, a sudden headache that's not typical. All of those things should be potential signs of stroke and should tell someone that something bad is happening, and they should call 911 immediately. We have a website that people can go to called stroke.nih.gov. And so people can go to that website and get more information about stroke. Really important for people to understand that hypertension, diabetes, high cholesterol, certain lifestyle behaviors like exercise, not drinking too much alcohol, and quitting smoking, all of those things can lower your risk of stroke. And so that's really important to get the word out about.